Now, on August 26, 2014, a 3-year-old girl named Tatiana Emerson was rushed to the Chattanooga hospital with catastrophic injuries. The man who brought her was 34-year-old Rhasean Lowry.
A doctor testified she had no brain function and couldn't breathe on her own when she got to the hospital.
He claimed she had fallen down a flight of metal stairs. Within days, Tatiana would be dead, and Lowry would face charges of criminal homicide. But what doctors discovered during her treatment would tell a far different story than the one Lowry provided. See, Rhasean himself was Tatiana's sole caretaker that morning. He was the only person who could have inflicted the injuries, and despite his claims of an accident, the evidence told the real story, a story of violence against a defenseless minor that ended in her death. Rhasean was addicted to corn, and he was watching it that very day. This was found by police when viewing his browser history. You know what's funny? If police went through my browser history, I wouldn't have anything to worry about, would you? It is believed he was essaying Tatiana whilst watching it. You know, YouTube have reprimanded me. They told me I curse too much, or my descriptions of these people are too harsh. When they do this, what the fuck do you expect? Muppet, donkey, this guy was just a dirty bastard. And I know that bit is just disgusting, but there are a whole bunch of injuries that came. But let's go to the part where Tatiana was rushed to the hospital. So when Rhasean arrived at the hospital with Tatiana, he explained that the little girl had caught the toe of her flip-flop and fallen backward down a flight of metal stairs with concrete anti-tread mats. It seemed like a plausible accident. Children fall and stairs can be dangerous. But as doctors began examining Tatiana, red flags immediately appeared. See, Dr. Gregory Talbot, the division chief and medical director of pediatric critical care at the Children's Hospital, he was the attending physician. When Tatiana arrived in his care, she was in critical condition and shocked. She required mechanical ventilation. She had dangerously low blood pressure and needed a blood transfusion due to bleeding problems. Now, medical personnel simultaneously worked to resuscitate her. Dr. Talbot knew that getting an accurate history of what happened was vital. And at that moment, Rhasean Lowry repeated his story about the stairs. But when the doctor conducted a thorough examination, what he found did not match this explanation at all. Tatiana had tissue swelling on the left back portion of her head and marks around both ears deep in the earlobes. This immediately concerned the doctor. Injuries of the earlobes, particularly on both sides, is highly correlated with inflicted injury rather than accidental falls. The doctor, when he went on to observe other parts of her body, he saw injuries to the V. If you want to know what V is, pin comment please. There was too much damage, with injuries visible under the microscope and bleeding off the side around the V opening. A small, soft silicone Foley catheter had been inserted into her urethra during previous treatment, but it was not placed in her V. The 3 nurses responsible for the catheter had approximately 50 years of combined experience, and in the doctor's medical opinion, the catheter could not have caused the V injury. Bro, Rhasean, your mama brought you up wrong. Straight up. According to the doctor, she was SA'd. She also had lacerations and marks inside her mouth on her lip. These injuries combined with the ears began to paint a disturbing picture. And then the doctor noticed something else. A linear patterned bruise that wrapped around Tatiana's hip. This type of injury indicated she had been struck with a flexible object, something like a belt or a cord. Stairs, by contrast, are rigid and inflexible. They don't leave that kind of mark. Regarding the brain, Tatiana's neurological examination revealed a profound, devastating brain injury. She showed no evidence of upper brain function, no voluntary action whatsoever. Even her involuntary brain functions were absent. She was deeply comatose. The doctor described her condition as a combined brain injury from both blunt force trauma and a period of cardiac arrest when circulation to her brain was inadequate. The hemorrhaging in Tatiana's brain was evidence of abusive head injury, not attributable to oxygen deprivation or resuscitation efforts. When the doctor viewed the brain scans, he was shocked by the severity. She had massive brain swelling, small areas of bleeding within the brain, blood outside the brain, but beneath its covering. Later imaging showed she had no circulation to the brain, part of the criteria for brain death. In terms of additional injuries, trauma protocols required scanning Tatiana from head to abdomen. These scans revealed an injured spleen. You see the injuries I've mentioned so far, this can't have been a one-time incident. This was ongoing mistreatment. She also had bilateral retinal hemorrhages, bleeding in both eyes. The doctor emphasized that retinal hemorrhages of this nature require a massive amount of force, far more than anyone would reasonably use when handling a child. Now, what stood out most to the doctor is that if Tatiana had truly fallen down metal stairs with concrete slip treads, he would have expected to see scrapes and abrasions somewhere on her body. Instead, all of the injuries appeared to be blunt trauma. The constellation of findings, bilateral ear bruising, pattern marks on her body, splenic bruising, retinal hemorrhages, severe traumatic brain injury, and the absence of abrasions were completely inconsistent with a fall down the stairs. Rhasean, you dumb motherfucker. And despite aggressive medical intervention and support for all her vital organ systems, Tatiana progressed to brain death and was pronounced dead. Some of her organs were harvested for donation. If this is prolonged mistreatment and not just one isolated incident, then the mother, Melanie Emerson, also has questions to answer. However, because she wasn't there at that time, there's not much information available on her. So, the autopsy was conducted by James Metcalf. He determined her manner of death was homicide, caused by blunt force injuries to her head and trunk. The pattern of injury was consistent with inflicted multiple blunt trauma. The extent of Tatiana's injuries was staggering. She had 70 marks all over her body, on her head, backside, chest, back, hip, and extremities. More than half were on the front of her body. On her right hip was a H-shaped mark. She had a row of 4 injuries on her left leg and a row of 5 on the left side of her chest. Injuries on her left hip wrapped around her body. Internally, the damage was equally severe, especially on the left lung. Her stomach had a large mark in the wall that tore through the lining. Her spleen showed similar in the front middle part. One loop of her small intestine was affected. The doctor believed all these injuries were caused by the same force based on their appearance. The stomach injury was particularly telling. It was in an area ordinarily protected by the ribs, requiring substantial force. The injury was localized and roundish, and in the doctor's opinion, a force going up under the rib cage would have been necessary, an upward force. The instrument that caused it would have been 2 to 3 inches in size. This type of injury would not ordinarily occur from falling down the stairs, because that area is protected. Tatiana also had a fractured rib with bleeding around it. Part of the injury occurred at the same time as her other injuries, but another part showed signs of healing and might have occurred several days earlier. Neither injury was associated with CPR. I mentioned previously all the head trauma. She had injuries on the right side of her head, right eye, and right ear, with spotty marks on the scalp above the ear. When doctor peeled back her scalp, he found extensive marks indicative of substantial force. The left side of her head also showed similar, including a fan-shaped mark above and behind the ear that looked like fingers. There were 5 marks across the top of her head, and they were inconsistent with the fall down the stairs. She had marks on her left jaw and cheek, marks in the inner upper lip, a laceration on the inner lower lip, and a torn frenulum. I've made over 500 true crime videos. I've never read an autopsy report as extensive as this. And if you look at his images, what the hell are you smiling for? All these injuries requiring substantial force, something squashing her lips against her teeth. She suffered a subdural hemorrhage mainly on the right side of her head, and a hemorrhage toward the back, top, and sides, and of the brain's grey matter. She also had hemorrhaging in her brain stem. None of these injuries were attributable to oxygen deprivation or resuscitation efforts, with the possible exception of the brain stem hemorrhages. The doctor observed hemorrhages in Tatiana's retinas and blood around the optic nerve, which can occur with substantial force, especially the blood around the optic nerve. He also documented a whiplash-type injury to her spine, evidenced by hemorrhaging between the 3rd, 4th, and 5th vertebrae. And obviously I've written the script for this video to describe it for you, but the more and more I read it, the more and more I just want to wince. The patterns of injuries was not consistent with a fall down the stairs. It was consistent with multiple inflicted injuries. And with all of this, Carshawn and Melanie were arrested by police. In the trial, the defense hired Dr. Thomas Young, a forensic pathologist who testified that in his opinion, the autopsy findings were entirely consistent with Lowry's account of Tatiana falling down the stairs. The doctor claimed that small children who suffer even relatively minor head trauma can experience a brain swelling made worse by subsequent trauma. His primary theory centered on coagulopathy, a blood clotting disorder. He claimed that when Tatiana was deprived of oxygen for 20 minutes, her blood clotting cells stopped working and her blood vessels became leaky. When circulation resumed, she would have started bruising and bleeding extensively. According to the doctor, her injuries, including in her brain, was evidence of this clotting disorder rather than blunt force trauma. Dr. Young attributed many of Tatiana's marks around her body to medical handling during hospitalization, claiming any handling would cause injuries to a child whose platelets weren't working. He insisted the subdural hemorrhage was not traumatic but evidence of oxygen deprivation. The retinal hemorrhages, he said, were caused by brain swelling, not trauma. He even claimed what Dr. Metcalf identified as lung contusions were actually complications from being on a respirator. Bruv, you can't help but laugh at this guy. He decided to wake up and thought, you know what, I'm going to go to court and I'm going to take the piss. I'm going to blame all the doctors. I'm going to blame all the medical personnel treating the child just before she passed. How does he live with himself? Regarding the gastrointestinal injuries, Dr. Young believed they resulted from the combination of the fall and oxygen deprivation. The rib fracture was caused by CPR. The V injury was possibly caused by the catheter insertion. The spinal hemorrhages would be expected from hospital handling and a fall down the stairs. Sorry bruv, you're just talking bollocks. So, during the cross-examination, his credibility, Dr. Young's credibility, took significant damage. He acknowledged that Dr. Metcalf's autopsy was thorough, but claimed he was drawing the wrong conclusions. He admitted that in the early 2000s, when he worked as a medical examiner, he had attributed injuries like Tatiana's to trauma and ruled such deaths as homicides. So in the past, when he has seen similar injuries, he's like, yep, it's a homicide. So they asked him, okay, well, what's different now? And he said, well, over the past 10 years, I've evolved. Dr. Young no longer believed in shaken baby syndrome, explaining that in pathology, you have this thing called progress, where basically people learn things over time and things are discovered. Since resigning as chief medical examiner, Dr. Young had testified primarily for criminal defendants, many accused of unaliving children. The state walked him through multiple cases where he had provided remarkably similar testimony in Louisiana, Illinois, Kansas, Marion County, each time claiming the injuries on the child were actually the result of oxygen deprivation, causing coagulation issues that led to bruising from medical treatment or other benign causes. And when confronted with this pattern of his testimony, he insisted every case was unique and different, though he conceded a lack of oxygen and a lack of blood flow may be the final common pathway in many cases. But regardless of all his tomfoolery, the jury didn't buy his theory. They convicted Rhasean Lowry of felony murder and aggravated child mistreatment. The court sentenced him to life in prison for the murder and then a concurrent 15-year sentence for aggravated child mistreatment. Rhasean Lowry appealed, arguing the trial court made various errors, but the appeals court found no merit in his claims. The medical evidence was simply too overwhelming. Melanie herself was sentenced to 5 years in prison. She has since been released. Tatiana, the daughter of Melanie, had been attacked, struck with objects. Her injuries were not the result of a tragic accident or a staircase. They were the result of sustained violence. At just 3 years old, Tatiana suffered over 70 injuries. Internal organ damage, rib fracture, devastating brain injuries, retinal hemorrhages, spinal trauma, and V injuries. The medical experts were clear. These injuries could not have resulted from a fall down the stairs. They were inflicted. Now let's move on to my next case, because I am sick of this dirty bastard. In the quiet neighborhoods of Wake County, North Carolina, December 7th, 2010 began like any other winter morning. Annie Wright kissed her 4 children goodbye as she headed off to work, leaving her 14-month-old daughter, Jada J, in what she believed were safe hands. Now, I'm not sure exactly how to pronounce the girl's name. Jada J is what I'm going to go with. Or Jada. Please don't chew my ass out. By the end of the day, little Jada would be fighting for her life in hospital, and within 48 hours, she would be dead. The man responsible for watching over her was Jonathan Blake Perry. He would soon find himself facing charges of first-degree murder. So this is the case of Jada J. Wright, a happy, healthy toddler whose life was cut tragically short, and the complex legal battle that followed. To understand the events of that December morning, we must first examine the complicated family structure that led to the tragedy. Annie Wright was a single mother of 4 children, working hard to provide for her family. Jada was born September 29, 2009. She was her youngest, and the only one fathered by Jonathan Perry, creating a complex family dynamic that would prove crucial to understanding the events that unfolded. Now, for the first year of Jada's life, Perry had minimal contact with both Annie and his daughter. He was largely absent during Annie's pregnancy. By the way, that's unforgivable. I don't give a fuck what your situation is. If the girl is pregnant and you're the father, deal with it and be there for her. He showed little interest in being part of Jada's early development. This changed dramatically in September 2010, 3 months before tragedy, when Perry made the decision to move in with Annie and her 4 children. Jada was a normal, healthy, happy baby. Her aunt, Yolanda Manson, remembered her as an outgoing child who had reached all her developmental milestones appropriately. At 14 months old, Jada could walk, drink from a cup, hold her own bottle, and pick herself up when she fell. That's pretty quick development, to be fair. She had no significant medical problems, took no medications, and never shown any tendency to choke on food or milk. She was a bright, smiling child who brought joy to her family. However, as Perry settled into the household, troubling patterns began to emerge. Annie noticed Jada would scream a lot when Perry held her. This was particularly concerning because Jada typically got along with people. Perry seemed to be the only male she didn't really favor. The tension was mutual. Perry frequently complained that Jada was clingy to her mother and made it clear that he just didn't like the fact she was so clingy. Perry, you're an adult. Grow up. This dynamic created an atmosphere of stress in the household. While Annie worked during the day, her mother typically watched Jada, an arrangement that worked for months. Perry only occasionally watched the child, and only on what Annie described as rare occasions. This limited interaction between Perry and Jada makes the events of December 7th significant. Now, on the morning of December 7th, everything began routinely. 5:30 a.m., Annie woke up, went through her normal morning routine with Jada. She changed the baby's diaper, gave her a bottle of milk, which Jada drank without any problems. During this interaction, Annie carefully observed her daughter and noted there were no marks on her legs or body. The child appeared completely healthy and showed no signs of distress or any injuries. Before leaving for work, Annie woke Perry, who had been sleeping in the living room. Upon being awakened, Perry moved into the bedroom where Jada was sleeping. At 6:30 a.m., Annie departed for work, taking her 3 older children with her and leaving Perry alone with Jada. This would be the last time Annie saw her daughter alive. The significance of this timeline cannot be overstated. Annie's careful observation of Jada that morning, noting specifically that there were no marks or signs of injuries, would later become crucial evidence in the case against Perry. The fact that Jada appeared completely normal and healthy when Annie left for work, but would be found unconscious and dying just hours later, created a narrow window during which the fatal injuries must have occurred. So at 11:30 a.m., Annie called home to check on Jada. During this brief phone conversation, Perry held the baby up to the phone, and Annie could hear her daughter's little baby talk. Annie later testified Jada sounded normal. This phone conversation would prove to be critically important, as it established Jada was alive around 11:30 a.m. After hanging up to enter a bank branch for work, Annie asked Perry to call her back as soon as she emerged from the building. However, when Annie finished her banking and attempted to call home, she received no answer. She called a second time again with no response. It was only on her third attempt to reach Perry that he answered the phone, and when he did, the news was devastating. Perry told Annie Jada was not breathing and she was gone. The panic in his voice was evident. Annie immediately instructed him to call 911 before hanging up and drove home as quick as possible. During her drive home, Annie called 911 herself, desperate to ensure help was on the way. The timeline here is crucial to understanding the case. Annie heard Jada sounding normal at 11:30 a.m., but 30 minutes later, she was dead, or not breathing at least. This narrow time frame, this window, became a focal point of the investigation and subsequent trial. The emergency response when Annie arrived at her home approximately 5 minutes after speaking with Perry, the scene was chaotic and heartbreaking. Emergency services were already on scene, carrying Jada's limp body to an ambulance. The sight that greeted Annie was every parent's worst nightmare. Her daughter, on the floor, was not moving. Her eyes were rolled back into her head and she appeared lifeless. The emergency medical technicians who first responded to the scene found Jada in critical condition. She was unresponsive, not moving, or breathing on her own. She had no discernible pulse and felt very limp. After emergency medical personnel moved Jada's tongue, she resumed breathing, but it was inadequate and labored. She did not open her eyes or respond to any stimuli. During the ambulance ride to Wake Medical Center, Jada's condition remained critical. She was unresponsive, breathing only about 4 times per minute, and vomited a thin white fluid. Most concerning of all, she never regained consciousness. The emergency personnel conducted various tests to rule out common causes of such symptoms in children. They determined Jada's blood sugar was normal. Her airway was not obstructed, she was not on any medication, she did not have a fever or history of seizures, and she had not had access to cleaning products or illegal drugs. Meanwhile, Perry's behavior during all of this was kind of weird. According to Annie, Perry was running back and forth, arguing and fussing with the ambulance personnel. His agitation was so disruptive that Captain Tony Pack of the medical services had to call police to restrain him. He kept interfering with the medical treatment. When they asked him, "Okay, Perry, what happened?" he provided an account that would remain consistent throughout the investigation, but which would later be challenged by medical evidence. He claimed he had given Jada a bottle, left the room while leaving her on the couch, and returned 8 minutes later to find her gargling, unresponsive, and not breathing. Now, at Wake Medical Center, her condition continued to deteriorate rapidly. She began posturing, which medical personnel explained as a term for stiffening of the extremities. The development was particularly ominous, as it indicated that the swelling in Jada's brain had reached a critical point, where it was actually beginning to force the brain out of the hole at the base of the skull. According to one of the doctors, these symptoms generally occur almost immediately before death due to head trauma. The medical team at the medical center quickly realized that Jada's injuries were beyond the the capacity to treat. And after providing initial stabilization, they made the decision to airlift her to the University of North Carolina Medical Center, which had more specialized pediatric trauma capabilities. Now, during the transport between hospitals, Annie confronted Perry with a direct question, "What did you do?" And he didn't respond. He remained silent. When investigating officers arrived at the hospital, Perry walked away from them. An hour or two later, Annie repeated her question to Perry, and once again, he remained silent. However, Perry did speak with Melissa Williams of Wake County Department of Human Services. To her, he repeated his account of what happened that morning. According to him, he put Jada on a sofa with a bottle, and when he returned, she was lying on the floor, choking with her eyes closed. He claimed Annie had directed him to call 911, and he insisted he had not harmed Jada. Now, at the University of North Carolina Medical Center, the medical team made desperate attempts to save Jada's life. Attending physicians drilled a small hole in her forehead to install an intracranial pressure monitor, a device designed to measure the pressure inside her skull caused by brain swelling. They also administered various medications in an attempt to reduce the swelling in her brain. Despite these aggressive medical interventions, the damage to her brain was too severe. The medical team fought valiantly, but the injuries she had sustained were too much. In the early morning hours, December 9, 2010, 2 days after the incident, 14-month-old Jada Wright was pronounced dead. So, medical professionals began conducting a thorough investigation on the nature of all of this. Dr. Molly Burkhoff, the medical director, was called to the hospital to evaluate Jada's condition and determine whether her injuries were consistent with the account provided by Perry. Dr. Burkhoff was an expert in what medical professionals call abusive head injury, a term used to describe injuries to a child's head or brain that appear to have been intentional rather than an accident. According to Burkhoff, the most common injuries seen in children who had experienced abusive head trauma include intracranial hemorrhages, bleeding inside the brain, or retinal bleeding. Burkhoff explained that abusive head trauma is thought to be related to the child's brain being moved in a rotational way, not in one linear kind of direct manner, but instead potentially as a result of shaking. This is very different to those typically sustained in a fall that Perry described. So when they conducted their initial examination of Jada, Burkhoff made disturbing discoveries. She noted the presence of marks and scratches on Jada's body that were concerning. Most significantly, she found marks on Jada's thighs and abdomen that were not in a typical location for a mark in a toddler. She also observed unusual marks and bruises on Jada's behind. In Burkhoff's professional opinion, this bruising constituted further supporting evidence of trauma. Now, the medical imaging of Jada's brain revealed the full extent of her injuries. CAT scans showed a subdural hematoma in her brain, as well as significant swelling of her brain cerebral edema. According to Burkhoff, the most significant thing on these scans for Jada was the amount of cerebral edema that she had and the bleeding there as well. Burkhoff's analysis of these findings were damning. She concluded this was not because of a fall. Furthermore, the retinal hemorrhaging is rarely seen in accidental injuries, but it's commonly associated with abusive head trauma. And Burkhoff considered this to be more supporting evidence for the child being diagnosed with abusive head trauma. Burkhoff reached a conclusion about the cause of Jada's injuries. In her professional opinion, all of this was likely a result of abusive head trauma, in addition to the other findings that were identified from a clinical evaluation and a radiologic evaluation. She looked at the size and the location of the bleeding in the brain, combined with the extent of swelling, and this was not consistent with a fall. Her whole brain was swollen. Eyes were bleeding. This doesn't happen from a fall. Burkhoff determined that the injuries seemed to have developed over a very short period of time, based on the rapid onset of symptoms resulting from abusive head trauma. She believed the injuries might have been caused by potentially shaking or having a child's head strike an object or an object strike the child. Now, you had further doctors who also conducted autopsies, and they found more disturbing evidence. Dr. Privet observed small blunt injuries in Jada's forehead and lip, marks on both of her hips, and a recently inflicted blunt force injury to her ribs. The rib injury was particularly significant because it indicated Jada had sustained additional trauma beyond what might be expected from just a fall. The internal examination revealed the full extent of the violence that had been inflicted, and after examining Jada's brain tissue, Dr. Privet identified the injury caused by the insertion of the intracranial pressure monitor. However, he found at least 6 other areas of bleeding that were not consistent with a fall. Dr. Privet determined Jada had sustained blunt head injuries that caused impact or pressure significant enough to damage the tissue and cause blood to leak. He believed that Jada had been subjected to multiple violent impacts. Now, to ensure the thoroughness of the medical investigation, Dr. Thomas Bulden, a professor of pathology, reviewed Privet's autopsy report and conducted his own examination. His findings corroborated and expanded upon the previous medical conclusions. He observed recent subdural bleeding, which is typically caused by the rupture of blood vessels. He looked at a microscopic examination on the tissues in both of Jada's eyes, and it revealed the presence of multiple retinal hemorrhages. And these were not superficial hemorrhages but involved multiple layers of the retina. The finding was significant because such extensive retinal hemorrhaging is rarely seen in accidents. He emphasized that the unexplained brain swelling, subdural hematoma, and retinal hemorrhages caused him to conclude Jada's injuries were intentionally inflicted. So, Perry was eventually arrested, and during the trial, in an attempt to counter the overwhelming medical evidence, he retained Dr. Donald Jason for the defense. Jason reviewed all the injuries, all the reports. He offered a different interpretation of the evidence. In his opinion, Perry's account of the events surrounding Jada's injuries were consistent with the possibility she fell off the couch. He believed a concussion with consequent loss of her gag reflex caused this, resulting of inhaling milk and being unable to deliver oxygen to her brain for 8 to 10 minutes. Jason said that the injuries to the back of her head might have been caused by this short fall, and that the marks on her body were relatively minor and consistent with her status as a toddler. He denied that retinal hemorrhages necessarily indicated child mistreatment had occurred, and suggested that Jada's subdural hematoma was easily explainable as resulting from the intracranial pressure monitor. Remember that device that they placed in there. Dr. Jason testified that the combination of subdural hemorrhage, subgleal hemorrhage, and retinal hemorrhage was not necessarily indicative of mistreatment because Jada's injuries could have occurred accidentally. He noted, in his experience, child mistreatment often resulted in skull and rib fractures, neither of which were present in this case. That's a bit weird. Well, because the child didn't have this injury, we can discount all the other injuries. Muppet. Of course, his testimony was significantly undermined during cross-examination. He was forced to acknowledge that Burkhoff's notes indicated the presence of cerebral edema and subdural bleeding prior to the installation of the pressure bolt, contradicting his theory that the monitor caused the hematoma. He also conceded that the relevant medical literature indicated that fatal injuries don't often result from a short fall. So based on the medical evidence and the circumstances surrounding Jada's death, law enforcement moved quickly to file charges against Perry. They charged him with felonious child mistreatment inflicting serious bodily injury and first-degree murder. And it was May 29, 2012 when he went to trial. The trial was a comprehensive examination of the medical evidence. The prosecution presented the testimony of multiple medical experts who concluded that these injuries were intentional and could not have happened from a fall. Even though the defense said no, this was an accident, the weight of the evidence was overwhelming. And on June 4th, 2012, after careful deliberation, the jury returned verdicts finding Perry guilty of first-degree murder on the basis of the felony murder rule. He was sentenced to life in prison without the possibility of parole. This cheeky bastard decided to appeal the decision. His legal team was not prepared to accept the verdict. They raised several significant legal challenges. First, Perry argued that the trial court committed plain error by allowing the admission of what he characterized as unreliable and inaccurate testimony from the state's experts. He contended that recent developments in medical science had cast doubt on previously accepted theories about the causes of brain injuries in children. Respectfully, Perry, what the fuck do you know about developments in medical science? But the Court of Appeals found this argument unpersuasive. The court noted Perry had failed to object to the expert testimony at trial, meaning that the court could only review for plain error a much higher standard. Perry had not presented any evidence at trial regarding changes in medical science or research, so the Court of Appeals rejected his argument. The court found there was substantial evidence Perry was alone with Jada when she was injured, and her injuries were neither self-inflicted nor accidental. Perry's account of events conflicted with the medical evidence, and in the end, the appeals court told him to fuck off. Now, Rhasean Lowry, in the first case, is one of the most disgusting, vile people I came across with. A lot of this video, I know you were thinking, what the hell? You may have squinted your eyes, you may have found it cringe, you may have, with all the injuries, right? What a world we live in, eh? As for Perry, he's not worth any more words, to be honest. Comment, tell me what you think.